My name is Antonio Palumbo. I'm an hematologist at the University of Torino in Italy. I'm here at ASCO to present some data related to a comparison on a large series of patients between treatment with continuous treatment versus a fixed duration of treatment. We basically pulled together three different studies. One was a study on Velcade continuous versus fixed duration in elderly patients. Another study was on lenalidomide in younger patients after autologous transplants. Once again, continuous therapy versus fixed duration of therapy. And the third study is in elderly patients with lenalidomide continuous therapy versus fixed duration of therapy. So basically we analyzed around 1,300 patients and we basically compare both in terms of progression-free survival and overall survival the outcome of those patients. As expected, the progression-free survival from diagnosis to first relapse show a clear advantage for the continuous treatment versus the fixed duration, with a difference of around 12 months. Then we also evaluated the duration from diagnosis not to first relapse but to second relapse to put together the first and the second remission. This has been done because some data might suggest that after continuous treatment, the relapse could be more aggressive and therefore the second remission should be shorter. Our data pulling together the first and second remission, and this is called PFS2, clearly showed that the advantage is still there. When we compare on a PFS2 continuous therapy versus fixed duration, the difference is still around 1 year. So this has been done because in other study where they were comparing purely the second progression-free survival, that means the time from first relapse to second relapse, the difference was not so clear. And one of the reasons this difference was not so clear, that when you analyze only relapse patients, you do not take in consideration all the others that still are not in relapse. So for that reason, we do believe that we should include not only in the future trials, we should include the evaluation of the PFS2, that is the time from diagnosis to second relapse, not first relapse.